I'm Dr. Payal Mukherjee. I'm an adult and paediatric ENT surgeon with a special interest in hearing and balance disorders. I work at the Sydney ENT Hearing and Balance Centre, which is located at the Sydney Adventist Hospital. Well, hearing loss is a particularly significant problem, not just because it's very common, but it's also very poorly treated. And that's why it's important to raise awareness about it. Hearing loss affects 1 in 6 Australians. About 70% of people over 70 are affected with hearing loss. But about 6% of the huge economic cost of hearing loss is actually due to treatment, and more than 57% of it is actually due to loss of productivity. So you can see how important it is in terms of what effect it's having on the average Australian. The most common hearing condition, most common cause of hearing loss in adults is probably age-related hearing loss. But the most common, in children we see a completely different picture. And probably the most common cause of hearing loss in children, thankfully temporary, is glue ear. Or hearing loss associated with middle ear infections. With adults, usually it is a slowly progressive hearing loss. So a lot of the times people not necessarily aware that they've got the hearing loss until it gets to a point that it starts to significantly have an impact on it. And it probably starts to impact them particularly in public spaces where there's noise, because they find that their speech comprehension in noisy environments will reduce. And oftentimes that means that they blame it to the environment rather than think that it is really perhaps their hearing. And then it starts to get progressively worse, and they start having problems in the house, listening to the TV, listening to the wife or the husband, or it may be that the wife starts to have a hoarse voice because the husband can't hear her. So there'll be implications in the family. The other thing that it can present as is also tinnitus, so ringing in the ear, and that can be more troublesome than the hearing loss itself. So patients will often present complaining of tinnitus, and then that sparks investigation into assessing their hearing. So they're probably the most common reasons people present. But there are other reasons of hearing loss, such as noise-induced hearing loss, which particularly in today's youth is really important to be aware because of the amount of noise that we're exposed to in day-to-day life. There's hearing loss associated with infections, or ear diseases. So infections, a condition called cholesteatoma. There are tumours that may cause hearing loss, or inner ear hearing and balance disorders such as Meniere's disease. So there's a whole myriad of things that can cause hearing loss, but by and far the majority of them are not related to any cancers or anything nasty, but and are usually slow and insidious. Sometimes hearing loss can present very suddenly, so it's called sudden sensory neural hearing loss. And the most important part of that type of hearing loss is to get access to a doctor really quickly, because it's the only thing, it's when people present quickly that it can be treated. But if that boat of that timeline of a week to 2 weeks has passed, doesn't matter how much medications you give them, it may not be possible to get that hearing back, and then you have to manage it using hearing aids or cochlear implants, depending on how bad the hearing loss is.